Hello everyone, I am Dr. Surbhi. I am a certified medical coder. On this channel, I teach medical coding concept in a simple and clear way. I focus on important guidelines, practical examples, and real-world scenarios. My goal is to make coding easier to understand and apply. I hope this helps you prepare better for your CPC exam and build confidence in your coding skills. In medical coding, modifiers can feel confusing when you are starting out, right? That's why I started a new series where I explain one modifier at a time by using simple language and real-world example. So stay tuned till the end. Today we are starting with modifier 25. Modifier 25 is one of the most commonly used yet often misunderstood modifiers in medical coding. Let me explain what modifier 25 is and when it is used. Modifier 25 is applied when a significant, separately identifiable evaluation and management service is provided on the same day as another procedure or service by the same provider. In other words, it signals to the payer that evaluation and management service went beyond the routine work that usually comes with the procedure. Now let's look at an example to make this concrete. A patient comes to a cardiology clinic with chest discomfort during exercise. The cardiologist performs a complete E&M, including history, exam, and medical decision making, and then decides that a cardiovascular stress test is needed that same day. Since the E&M visit included a full evaluation that went beyond the usual work for the stress test, we report the E&M code with modifier 25 to show it was separate and then report the stress test on its own. So whenever you see a situation like this, ask yourself, was there any extra evaluation beyond the procedure? If yes, modifier 25 may apply. Now let's talk about the top 3 common mistakes to avoid while using modifier 25. First, don't use modifier 25 for routine or standard work. If the evaluation is just part of the procedure, it is not separate. Second, avoid using it when there is no extra E&M service. If the visit was only for the procedure, modifier 25 doesn't apply. Last, make sure your documentation supports it. The note must show a clear, separate E&M service is performed on same day. So now let's revise the key points to remember. First, modifier 25 is used only with E&M codes. Second, the E&M must be separate and significant. It must go beyond routine procedure work, and clear documentation is essential. Modifier 25 can be a valuable tool when used correctly, but it is also one of the most reviewed and sometimes denied modifiers because of documentation issues or misuse. In the next audio, I will explain another key modifier. Keep following along if you are sharpening your medical coding skill. Until then, stay happy, stay safe. Bye.